The Australia Zoo Wildlife Hospital is the heart of wildlife warriors. Each year, around 10,000 patients are brought in for treatment.
May have been the victim of a malicious attack.
For our hospital team, any given day can present a variety of challenges, and it's safe to say that no 2 days are ever the same. Today, we're back for another day at the Australia Zoo Wildlife Hospital. Dr. Burt has just arrived for the day when he tends to his first patient. A local brush turkey was presented with fractures to both his wing and leg. However, there is something else alarming Dr. Burt.
So we've got Crusader here. What's most concerning is he seems to have a ball bearing that's lodged in the lower part of his body, where we suspect he may have been the victim of a malicious attack.
Disturbingly, Crusader has been shot by a member of the public. As a result, he has also sustained fractures to his left wing and his right leg. These injuries are likely to be weeks old.
This is, of course, a pretty significant, an old fracture really that's sort of healed, or what we say formed a bony callus.
Under sedation, the ball bearing is removed.
The entry point for this object seems to have healed over, and he's had enough time for his body to have some form of a healing response to the old injuries. Not that uncommon to have wildlife admitted to the hospital because some rather cruel member of the public has shot them with some form of a pellet gun, air rifle, or a similar sort of firearm or projectile weapon. The kinds of things that we see, it's one of the harder aspects of the job, I think, to be confronted with.
Thankfully, the pellet was removed, and Crusader can continue treatment for his other injuries under the care of Dr. Burt. Across the hospital, Macy the Pelican is in recovery after a fishhook was surgically removed from his leg. Even though the surgery was successful, his injury has left further implications. After reviewing x-rays, Dr. Katie is taking a look at Macy's wound.
It is a bit swollen, so I'm just going to take a sample to see if it's infected and if we need to change our treatment. We might test this just to make sure that it's not resistant to the ones that we're using. We would have really hoped that this would be improving and more comfortable by now.
The next step is to examine a sample of fluid under a microscope and identify if there are bacteria cells present.
So given that it looks like there is bacteria in the sample, I will culture it to test the sensitivity because we really want to get on top of this, especially because the wound is quite close to a joint.
If all goes to plan, Macy will be able to fully recover from his surgery.
Okay.
While already caring for multiple patients, Dr. Katie is presented with a beautiful freshwater turtle, Passion. She was admitted to the Wildlife Hospital after being struck by a car. Immediately, local anaesthetic and pain relief is administered around the trauma areas. As you can see, these injuries are pretty confronting. The shell of a turtle is part of their skeleton, similar to the spine of a human being. With damage like this, Passion must be in immense pain.
It's pretty major, but I think this is just what we're seeing on the carapace and that the pelvis is okay, except for the back of the pelvis there, but that may be what we can see underneath. That goes quite deep, and if it goes too deep, then it's so hard to fight off infection. I think a lot of people don't realise that, unlike in cartoons where their shell is their house that they can retreat into, this is actually their spine and their ribs and part of their skeleton. So when we see things like this, that's like breaking your back. It would be so, so painful, which is why I wanted to straight away give some really nice sedation and pain relief and local anaesthetic as well. Because it is bony material, as long as you can get it stable and touching, it does then fuse back together and sort of recover itself. So they're amazing at healing. We've seen some that have come in and obviously healed bad fractures from a long, long time ago in the wild, and they can heal huge deficits.
The x-rays showed no internal injuries. However, Dr. Katie is concerned about how deep these fractures are, and if she will be able to piece this poor turtle back together.
Now we want these edges to line up, which is usually fine if you've got a crack or a straight fracture, but here we've got this one section that's been pushed in, which would be really hard to fix up. Hello. You going okay? I have put a fair bit of local anaesthetic in here, so I'm going to see if there is any reaction when I flush some fluid there.
To see just how deep these fractures are, a simple but creative technique is used.
I'm going to flush a little bit of fluid and see, is it going to run off, showing that this is just superficial, or is it going to disappear inside the body cavity, showing me that this is a lot deeper than I'm hoping.
The results are positive.
So while the cracks have gone all the way through the bone, there's still a lining inside the body cavity, sort of encasing all of the organs. I can see all the way through this layer of bone. I think that layer of tissue is intact, because when I was flushing lots of fluid there, it was all coming straight back out instead of disappearing into the cavity. Next step is going to be to try to get these edges to meet again, which could be really difficult just from how complex these fracture lines are.
Now that Dr. Katie is certain the injuries are completely external, the fractures need to be realigned and stabilised.
I'm going to flip over and try to fix this underside first. I guess if there's anything that's going to make me call it on this total, it's if I can't fix that side. So with some standard injuries, we've obviously got protocols, we're trained at university, we practice all the best ways. And then you get some weird injuries like this. Just gluing some beads to the bottom so that I can use that as a point to stitch to, seeing as I can't stitch through bone. I feel like the bony connection is really nice here, and here it's pretty much as good as we could get it. When we first started, there were steps. This was dropped, this area was dropped. And with some gentle manipulation and going piece by piece, we've actually managed to line everything up really well, which is going to be great for this healing. All the edges are touching enough to heal. It's just going to be a matter of time and hoping that all of these little implants stay in place, which they should. So overall, I'm pretty happy. It's still going to take several months until we're ready for release, but at least he'll be able to do it in hospital comfortably. It looks a little bit messy, but that's our arts and crafts, and we fixed the fractures, so that's really positive.
Dr. Katie was able to repair Passion's fractures with the hope that she would make a full recovery. However, Passion's injuries were vast and complex. Sadly, she passed away. Being safe on the roads is not only important for our safety, but also the safety of our wildlife. Please take care when driving, and always be aware of animals on and around roads.